Firstly, I would like to acknowledge the unceded territorial lands of the Lekwungen. They are the Songhees, the Esquimalt, and peoples to which UVic resides. Welcome, my name is Corrina Burns, and I'm a student here at the University of Victoria. The presentation I will be sharing with you, and also the title of the project I'm working on, is Understanding General Population Impact and Opportunities from Changes to Blood Donation Screening and Criteria for Men Who Have Sex with Men. So my slide, thank you, there we go. Today I will take Practicum and my research role, emerging data, highlights and accomplishments, knowledge, skills, and values, calls to action, and my closing thoughts. My practice SHARE, or Community-Based Health Equity Research Group here at the University of Victoria. According to SHARE's website, research is a collaboration between researcher, research community, and stakeholders in participatory, logistical, and equitable ownership of the knowledge. This mixed methods project is funded through Canadian Blood Services and Quebec. Research project cannot exist without stakeholders. Some stakeholders in this project are SHARE and the interprofessional working Canadian Blood Services and UMac Quebec, who provided the research grant, and the University of Victoria for ethical. Also, blood disorder organizations such as the Thalassemia Foundation of Canada and Canada. As well, stakeholders are men who have sex with men, which is inclusive of gay and bisexual men. Blood product recipients. I worked in the area of blood product recipients during my practicum. The Nothing About Us Without Us slogan has grown to empower many disenfranchised communities. In line with community-based research and collaboration with all stakeholders and inclusive of ethical principles. As to core certification is certification regarding ethical conduct when working with human research. It provides three ethical principles: respect for persons, concern for welfare, and justice. These are evident in a research article published in 2019 that speaks of the need for gender-blind as opposed to current blood deferral screening, which targets men who have sex with men specifically. During my practicum, I completed the TCPS2 core certification, improved my research literacy, participated in administrative work. I was also able to work on data collection by facilitating one research interview and describing 4. Wrapping up my practicum, I was able to dabble in qualitative data analysis and present my presentation to the SHARE group. Some quantitative data collected from the first few is there are 5 participants, 2 are parents of blood product recipients, and 3 are recipients. There are 5 participants, 2 are parents of blood product, 4 are female, 1 is, and the blood conditions are 2 with thalassemia, 1 with hemophilia, and 2 with sickle cell anemia. Geographic lives in Alberta, 2 in Ontario, and 2 live in Quebec. They range in age, 1 is in their 20s, 3 are in their, and 1 is in their 50s. Their ethnicity, 2 identify as Black, 2 as Caucasian, and 1 as The research project is looking at the screening deferral policy for men who have sex with men, and he can move to gender-blind criteria questions. To clarify, screening takes place prior to blood donation. Testing takes place later in the laboratory. Currently, the Canadian Blood Services and MSM Quebec policy who have sex with men must abstain from sex for 3 months before qualifying to donate blood. This to engage in civic participation of blood donation, they must not engage in anal or regardless of relationship status and or their level of practicing safe sex. Here is some emerging data regarding how participants view the screening process versus the testing process. 2 participants screening were equally important. 4 mentioned screening may be discriminatory to ethnic minorities and women who 2 specifically said testing was important, and 5 spoke of the importance of testing in the laboratory. Moving along, the School of Public Health and Social Policy has a number of key areas of knowledge, skills, and values that are are of and reinforce one another. While in my practicum, these are the four most prevalent to me. Community approaches to research and knowledge development, ethical reasoning, sorry about that, ethical reasoning, just trying to get my screen to change slides. So I'm not able to get my slides. I will continue reading though. Ethical reasoning and action, qualitative and quantitative research, and inquiry and analysis. Each one identified has played a prominent role in my own learning curve, navigated through the new, enlightening, and complex experience into human research and social policy change. Number 19, calls to action from the Truth and Reconciliation Report. Speaks of gaps in health outcomes and acquiring measurable goals to achieve this action. I believe the key to operational action is to ensure research in both social and health outcomes inclusively while being cognizant of social determinants specific to Indigenous populations. Therefore, I will encourage and promote the following: research projects to actively recruit those who identify as Indigenous peoples to be stakeholders, participants, and or projects from inception through to publication and policy change. And Indigenous ways and knowledge must be paramount in research to aid in decolonizing methods, build trust from past atrocities, and create equitable relationships with communities. As my practicum has come to an end, my highlights and personal accomplishments are many, but I feel very privileged to hear participants' personal stories. My closing thoughts are with men who have sex with men and blood product recipients. The blood donation deferral screening project is complex. Change for, sorry, I'm having trouble clicking the slides here. For men who have sex with men could reduce stigma and improve their mental health while increasing the blood donation policy. But change must not endanger other people either, such as those whose health relies on blood products. This is a complex conversation between science and social idiosyncrasies. To close out my presentation, I would like to say thank you to my super Karen Fulcher and Nathan Lachowski, to my professor, Natalie Franzen, and to my amazing classmates, friends, and family. Thank you all for your support and encouragement as we head on my journey.